LASIK is an outpatient procedure that allows us to correct nearsightedness, farsightedness, and astigmatism. It's done by creating a flap using a laser, and then we lift the flap and laser in the patient's prescription. Recovery is very fast. Most patients are able to drive by the next day. The procedure is about 20 minutes, and it's all done under just numbing drops. There's no injections. And the accuracy of LASIK is phenomenal. It is the most accurate of all surgeries that we have. If you can't have LASIK, it may be possible to have LASIK, which is a surface treatment, or to have a Visian lens implant for patients who are very, very highly nearsighted. LASIK is a painless procedure. The numbing drops work instantly. Some patients feel a little bit of pressure when we create the flap, but it's certainly not an uncomfortable thing to go through. It's not possible to blink during the surgery because we have a lid holding device which cannot be overcome. Also, we have a little pillow that goes around the head and neck and hardens, and so that prevents movement of the head. But in addition, the laser has an eye tracking device, so small movement of the eye is actually tracked and the laser beam moves with you. Well, in the past, we created a flap with an instrument that had an oscillating blade, and now we're using a laser to create the flap and also change the shape of the cornea. So there's no blade or knives used during LASIK surgery. Well, customized LASIK means that we're actually using a device called a wavefront measurement, which captures the entire wave of light as it comes out of your pupil and then allows us to customize the treatment across your entire pupil. And that really creates a very vivid, sharp image and decreases halos and glare at night. Well, LASIK remains a surgical procedure. There is a hands-on component to LASIK, and also the planning and programming of the laser is individualized. Some places that have basically a bait and switch, they're advertising at a price that sounds too good to be true, and when you get there you find out that it is too good to be true, that price you only qualify for that price if you have no astigmatism or a very, very tiny bout of treatment, and that by the time they're done, you find out that it's far more costly than they advertised. Also, you will find that in many of those places, you may not see the surgeon except for the time of the surgery. All the pre-op and post-operative care, and in many instances, even the planning of the procedure is not done by the primary surgeon. Generally, insurance doesn't cover LASIK, but you can use flexible spending accounts to cover the procedure. Also, there's financing plans that are available that offer up to 2 years of zero-interest financing. Well, I think when you're looking for a LASIK surgeon, you want to be sure that someone has done a fellowship in corneal and refractive surgery and that they have a track record. You want to be sure that they're part of the innovation cycle, that they are part of clinical trials, that they've published, that they're considered national and international authorities in LASIK procedures.